Which cataract lens implant is the best? I've implanted thousands of these lenses and experimented with many different types over the years. A mistake in the choice of lens implant can have severe consequences and lead to long-term misery and even decreased vision. The ideal lens should provide you with excellent distance, intermediate, and near vision with minimal or no glare. I must emphasize that there is no one lens type that will be a perfect match for everyone. Each lens provides a specific set of benefits and risks that need to be tailored to you. I'll start with a fantastic lens I used successfully on thousands of patients in the last 3 to 4 years with satisfaction rates of more than 99%. This is the only trifocal lens available in the US so far, and it's called PanOptix. Trifocal means that distance, intermediate, and near vision are all in focus at the same time. So you could switch your gaze from distance to your computer or to your phone or even a book without needing to rely on any glasses. What I like very much about this lens is the clear vision and the very low rate of side effects like glare and halos. The next lens is called Vivity, and it's a lens that I generally use in pilots, truck drivers, and professional athletes. This lens offers a great distance and intermediate vision, but for the small print at the close range or prolonged reading, patients may need glasses, and they should be okay with that. What's most important is that this lens uses a unique optical mechanism that's different than any other lens on the market, and that's why it's least likely to cause any of the problems that are associated with other types of multifocal lenses, like decreased vision or circles around lights. In the rare case that one of my patients has a problem with a PanOptix or a different type of multifocal lens, I often switch that lens with the Vivity with excellent outcomes. It is also a better lens for patients that might have some other problems like severe dry eyes, macular degeneration, or glaucoma. I'm going to tell you about the newest lens option in a minute, but first let's talk about the lenses that in my opinion don't offer much value. The light adjustable lens is a lens that's designed to deliver superior accuracy in achieving perfect 20/20 for distance by adjusting the power of the lens after the surgery. However, today most modern laser biometers for the calculation of lens power are extremely accurate. Therefore, this lens serves no useful purpose in my opinion. The same goes for the older generation of multifocal lenses like Restore, Crystal Lens, and Symphony. Although these lenses were excellent in their times and offered many patients excellent distance and near vision, today there are much better lenses available. The newest lens I'm excited to talk to you about is the Odyssey lens. I started implanting this lens about 2 to 3 months ago, and so far my patients are extremely happy with its performance. I even tried it a number of times against the PanOptix in the other eye. Shortly, I will show you a testimonial of a patient that has an Odyssey in one eye and PanOptix in the other. Odyssey is similar in its mechanism of action to PanOptix. Although it is not technically classified as a trifocal lens, it does offer very good vision for distance, near, and intermediate. Patients report that the distance vision with this lens is particularly sharp. The only notable thing is a small minority of patients that report the presence of circles around light that usually disappear within a few weeks after the surgery. Ilan had a surgery a few weeks ago in which I placed an Odyssey lens in the right eye, and we placed a PanOptix lens in the left eye. And I'm going to show you how the result is and how she says. First of all, I want to hear from you. How's your vision in general?
My vision in general has been wonderful. I have not needed a pair of glasses since I had the surgery. I could read signs outside. I have no complaints.
So both distance and near are clear without glasses?
Correct.
In general, if I ask you which eye you like better, without thinking too much about it, the right eye is better or the left eye? Which eye do you like better?
Right.
So the right eye is the eye that has the Odyssey. She says that she likes better. However, I'm going to ask a few more questions to clarify. If we talked about glare and halos, which eye do you think you have more glare and halos with? Oh, we're talking about those circles around lights that you see at night when you drive, correct?
Yes.
Which eye has more of those?
The right.
The right has more of those, okay. We checked her vision, and checking her vision shows that the distance vision in the right eye is clearer than the left eye, and the near vision is pretty equal between the both eyes. So she has a very sharp vision for distance in the right eye, very sharp vision for near in both eyes. And so the vision in the right eye is sharper than the left for distance, but it is also a slightly more rings around light. How much does it bother you, the rings around light?
It doesn't bother me as much as it sounds, but sometimes when you're at a stoplight and there's three of them, you see all those circles and you kind of like, oh, you know. And
you see them more with the right than the left?
Yes.
Okay, great. The conclusion is that in this specific patient, the Odyssey lens has a better distance vision, significantly better distance vision, very similar near vision, and also the intermediate is similar between the two lenses, right? The intermediate, this distance is also very similar.
The same.
Yeah. And as a result, the price that we pay is slightly more rings around light at night, which is not necessarily bothersome. Now, let me ask you the question of the hour. If we had to go back and put the same exact lens in both eyes, which one would you put in both eyes? The Odyssey in the right eye or the PanOptix in the left eye?
I think the left eye because I don't have circles.
You would want the left?
I think so,
I see. I got it. Okay. Thank you very much.
Thank you.
It is very important to realize that the level of your satisfaction with any particular lens is dependent on many factors other than just the lens. The most important one being the choice of surgeon and his experience with his lenses. The ultimate responsibility for matching the perfect lens to your unique eyes rests on your surgeon based on your goals, your eye's condition, and the surgeon's experience. So in many ways, choosing the right surgeon is the single most important factor for your satisfaction. So how much should these lenses cost, and what parts of cataract surgery does insurance company cover? Click on this next video to learn more about that.